আমরা এখানে আছি এবং আজকে সন্ধ্যায় আমরা সবাই স্বাস্থ্যসম্মত হয়ে আমরা বাড়ি ফিরব। বাংলায় yes, there is some okay. I'm going to go and was instructed to speak in English. How about Banglish? Banglish will work? Banglish will be better, huh? Okay. So let's start first, okay? We're going to talk about yoga as a therapy. Let me go back and tell you just a couple of hints by which you can incorporate in your daily lifestyle. First of all, yoga, just not a yoga. It's a joke. Amader Banglaয় আমরা বলি joke. What is a joke? It's a union. Union of our body, mind and spirit. So if you look at it in the computer sense, our body is like a hardware, mind is like a software, spirit is a programmer. So who is the programmer? I am the programmer. I am programming my software to fix my hardware. So we as a physician, we are all fixing our hardware, and people like Munib is trying to fix our software, called psychiatrist, okay? But psychiatrist, primarily, there is a lot of difference. They talk about all neurotransmitters. They'll be talking about a lot of other things. We'll be talking about mind. And what is mind in yoga is the input of your five senses. আমাদের পঞ্চ ইন্দ্রিয়। আমরা যখন যোগ করি, এই যোগটা এসেছিল আমাদের প্রথম, it came from Indus Valley civilization, which is Mohenjo-daro and Harappa. It was designed for your self-realization. আমরা বলি আত্মা দর্শন। But people who are practicing it, there are some health benefits. What were the health benefits? প্রথম হচ্ছে রোগের চিকিৎসা। আমাদের যত রোগ, I'm going to show it to you, some patients after patients, that what happens to their blood sugar, what happens to their A1C, and I'm going to pick you up, Nilu, Jillur, everybody is here, and they know, including myself, we have a tremendous transformation. What do you transform the practice? It's called rogi. Amra shobai rogi. Rogi theke amra hoy nirogi. No disease, then you go to yogi. So how do we transform ourselves? The first transformation is called Merudanda Achal. Merudanda Achal means the whole practice of yoga is a relaxation response. So you need to learn how to relax. আমি যখন দাঁড়িয়ে আছি, when I'm standing up, my skeleton is going to fall in the front. So what it does, my paraspinal muscles gets tightened up, keeps me straight. So if you put your hands here, you'll feel like a piece of stone. So the first and foremost thing, you have to keep your spine straight. Doesn't matter where. You're sitting, in the floor, sitting in a chair, your body will be in a 90-degree angle. Merudanda Achal. If I'm sitting if you want to see me, and I have a lot of chairs in my home, I've been always keeping my spine straight. If you keep your spine straight, initially, you'll start having relaxing. Second, monosthir. Monosthirটা হচ্ছে, what is the monosthir is that you learn how to quiet down your mind. Out of our five senses, most powerful sense is your vision. So you learn how to close your eyes and able to sit down in one place. Asana doesn't, it will come to you. How it will come to you? Once you connect, your hand is the connector between body and mind. Why? আমি যদি কিছু চাই, if I want something, I put my hand first before I even can say. If I say something good, I say this. So these are called hand mudras. In yoga, there are called hand mudras. You quiet down your hand. This is called your a dhyana mudra or jnana mudra, meditative mudras. Then what you do, any posture you are going to be in stages. In stages, impossible become possible. Pechon theke you may not able to see, so what Nazrul is doing here, and let me show it to you how you will incorporate. The biggest power is the power of your breath, and I'll show it to you. Your lung is like a balloon. It has 6 liter capacity. It needs only 1.5 liter to keep it open. 4.5 liter you can exchange. So the first, you learn how to breathe out. Amra boli na take a deep breath in. You cannot take a deep breath in. You have to empty your lung first. You have to breathe out first. Slowly take a deep breath in without any effort. Then you'll be breathing out longer than breathing in. You can keep on counting, 2 seconds in, 4 seconds out, 3 seconds in, 6 seconds out, and slowly you will see you develop a relaxation response. How do you do it? It is the activation of your parasympathetic tone. In exercise, heart rate goes up, blood pressure goes up, respiratory rate goes up. So what you will need to do, you will sit down in a posture of which you want to go in sequence. I'm going to go down if you have a mind sitting somewhere, and I'm going to show you the technique how to do it. So I will sit down here. First technique is, I'm going to তুমি যদি অফ করতে পারো কোনো অসুবিধা নেই, দেখা যাবে বেটার। হ্যাঁ, তুমি শুধু এটা জাস্ট প্রজেক্টরটা অফ করে রাখো, মাই কম্পিউটার উইল বি অ্যাজ ইজ। ওরা সব টেকনিক্যালি ভয় পায় যে once I turn it off, what will happen?
You will still be here, Dilip.
I will still be here, the laptop is here, and we have somebody named I know you very well by now, you know. He's been fixing all the computers. Okay. I'm sitting down here, crossing my leg, both the feet under my knees, and I touch my index finger and thumb. Anyway, you will be able to hear me. You know, don't worry about this microphone. I touch my index finger and thumb, close my eyes, and I pay attention to my breath. Breathing out first. I'm taking a deep breath in, and I'm breathing out. Muscle cannot stay contracted too long. Muscle has to start relaxing. When the muscle will start relaxing, what will happen? You will be able to go to the next step. And this takes place because I put my feet high up. This is called your stuff, we call it Siddhasana. Sukhasan to Siddhasana. Phenomena is called neuroplasticity. What is the neuroplasticity is that we are able to change our structure and function of our brain. Neurogenesis is an entity. We used to think that nerve doesn't grow anymore, but we have seen people are doing, you know, the prefrontal cortex grows. So this will be, I'm sitting down, doing the same phase, then I get slowly I will go into the balance. The next balance will be by putting the same feet now opposite side. What I'm trying to show it to you, you need to develop this relaxation response even sitting in the chair. You'll be sitting in a chair, you'll do the same thing, but I'm showing you how to do it. Next thing that you can see very easily, I can put my 1 foot high up. This is called your Ardha Padmasana, half lotus. One side I'll be able to do it. I will be able to do the other side, half lotus. And then when I'm enough relaxed, I will be able to get into what is called the Padmasana. Now people will say, oh, look at how you can do it. You don't do it. It will come to you. It will come to you because you're relaxed, spine is straight, you are sitting in a... All the yoga comes from the babies. Have you ever seen a baby? Yes. Baby does every posture of a baby is a yoga. They'll get up into downward facing dog. They'll get up into a cobra pose. They will be sitting down like this. They'll be sitting down every posture. So now you start a relaxation. You are in the chair. You can do also with me. Have you ever seen how a baby closes their fist? Who's a pediatrician here? Nobody? No mama?
All internists.
All internists? Let's close your fist. Let me see how you close your fist. Beautiful. Nobody has seen a baby. Baby will close the fist, got it, to the thumb inside and
That's what I did.
I see that. এটার নাম হচ্ছে বালো মুষ্টি মুদ্রা। বালো হচ্ছে বেবি। বালো মুষ্টি মুদ্রা। বালো মুষ্টি মুদ্রা will relax your hands and you'll do with your breath. So you can put your hand in front, breathe out first. Take a deep breath in. Breathing out to the Balo Mushti Mudra. Breathe in, breathe out. Breathe in, breathe out. In Western term, we call money back guarantee. All the aches and pains of your hands will go away. Why? All the pain comes from tightness. Remember, you had arthritis, you have a damage to the cartilage. Cartilage doesn't have any bone pain fiber. All the pain people are here. Pain fibers are in the ligaments and the muscles. So it is the tightening which causes. So wrist will get relaxed with your extension. Breathe in, breathe out. Breathe in, breathe out. Breathe in. When the wrist is relaxed, you see how beautiful it is. You can put your hand, your wrist will go down like this. Guaranteed, any pain in the wrist will go away. If it does not, call me. Second thing, very important. You do not cross your limit. Your limit is your pain. If you have a pain here, you back off. And your effortless breathing. Why? Your heart and lung is the same organ. What happens that if you put any effort in your heart, you have effort in the breath. Effortless breathing means you will be able to talk, you'll be able to sing, and I'm going to show it to you. I don't go too much, talk. Show it to you how you can do with your most important of the posture, what will make your whole body and respiratory system relax, you'll be doing in a chair. Let me get up and showing it in a chair. Very important. You guys sit down, because they're sitting there so they can do. It's called Paschim Namaskar, prayer pose to the back. Or let me do it standing up so you'll be able to see. First, you take your hand slowly where you are. Your hand is here. Stay here. Close your eyes, do your breathing, hands will come here. Slowly, you'll be able to do a prayer pose to the back. But don't cross your limit. Stay where you are, come back slowly. Then 1 month, 6 months, 6 years.
Oh my God.
Oh my God.
Oh my God, Dada.
We can do it, Dada.
Sometimes in your life you'll be able to do it, okay?
We cannot do
Nothing wrong
it.
in that.
Starting with the
Now, what is going to do for me?
No way.
If I stay in this posture, my neuroplasticity is setting in, all the muscles of respiration is relaxing. My tidal volume, which was half a liter, now is going to go to at least 2, 3, 4 times. Simple, it's called aerobic glycolysis. End product of metabolism is glucose. It combines with your oxygen, forms carbon dioxide, water, and ATP, adenosine triphosphate. If you don't have enough oxygen, it produces lactic acid, pyruvic acid, pain-producing substances. So, people like, I'm going to pick up somebody named called Masoom. He's singing, he's reciting, but he gets all the patient because of the pain-producing substance. You won't get me, So see, I have my hand here, and look how comfortable I'm feeling.
Oh my God.
So this
We can
is
do
called
it.
relaxation response. Then what I'm having now, let me show it
No
to you
way.
what is happening. You all physicians will understand. I have not taken water in a long, long time. I've been talking to you. Look, I have totally saliva in my mouth. My mouth is completely wet. No. I'm a ulto. Ulto hoche je my mouth is wet. Why? Because I have a parasympathetic activation. All the saliva, all the whole GI tract, from mouth to the anal canal is supplied by parasympathetic nerve. Parasympathetic is called calm and digest. Once you have a wet mouth, you know you have activated your parasympathetic tone. You will see in my presentation the cause of all the coronary artery disease, cardiovascular disease, I'll show it to you, is the high sympathetic tone, which you call a stress, and how the stress is affecting limbic system, hypothalamic pituitary organ. Eta hoche one of the most important daily yogic practice. Paschim Namaskar.
অনেক প্র্যাকটিস
এরপরে যেটা করতে হবে is called a spinal flexibility, and next thing is your head below your heart. Let me show you why it is so important. Suppose I'm here, okay? My intracranial pressure, intraocular pressure, intracarotid pressure is in a stable form because of baroreceptor sensitivity. We have baroreceptors. Now I'm going to go and slowly put my head below my heart. So what happens here, my face gets flushed, I cannot talk, I cannot breathe, my intracranial pressure is up, intraocular pressure is up, intracarotid pressure is up. But if I keep it down, slowly and slowly, that neuroplasticity sets in. I can talk, I can breathe. Slowly will come down, the hands will come down all the way down. Padahastasana. And my flexibility will come in, my hands will come down here.
Thanks for trying.
My hands will go to the back. I will be putting my head, my head will come all the way to the back of the head. So what is going to happen to you is that this is increasing your baroreceptor sensitivity,
One more time.
which is
No, don't bend your knees.
which is internist knee problem,
He tried.
So what is happening when you increase your baroreceptor sensitivity, it literally acts like a beta blocker. When you have a relaxation response, you reduce your peripheral resistance. And I will show it to you recently what will happen with the cardiologist here. When your chest is relaxed, when you can efficiently do a better breathing, you will have a negative intrathoracic pressure. So what will happen to you, your preload will go high up, your venous return will be up, and with the peripheral vasodilatation, your afterload will go down. So think about as a cardiologist. Preload is going to go up, afterload is going to go down. You have a tremendous increase in the ejection fraction. No medication can do it. Most important way to quiet down your mind is your balancing poses. The root cause of all of our disease টাকে লিখি DIS dash is. Dis-ease. Treatment of dis-ease is called effortless ease. বাংলায় আমরা বলি অসুখ। সুখ যখন চলে গেছে আমাকে অসুখ হয়েছে, হ্যাঁ? আচ্ছা, আমরা বাঙাল, আমরা আরেকটা কই কি আমাকে ব্যারাম হয়েছে। বে-আরাম, আরাম হারাম হাই, ব্যারাম। पंजाबी से तंदुरुस्त। আর কি বলে পাঞ্জাবি? এই তো সালাম উর্দু আর পাঞ্জাবি তো লোক है ना, কি বলে তা? এভরি ডে সুখ কি জিনিস? বাংলায় সুখের ডেফিনেশন। কিশোর, you understand Bengali more than me, you know, so because we are connected.
वो कलकत्ते में था ना पहले।
कलकत्ता में जाना है उसका। সুখের বাংলাতে ডেফিনেশন হচ্ছে অপ্রবাসী, অঋণী, দিনশেষে শাকাহারী। What does it mean? অপ্রবাসী। তুমি যখন তোমার ঘর ছেড়ে বেরোলে, তুমি যখনই গ্রাম থেকে শহরে যাও, তোমার সুখ চলে যায়, তুমি অসুখ। অঋণী, ঋণীটা তোমার পয়সা করি না, যেটা রিলেশনশিপ। You come to the United States, you are immigrant community, you have no connection with anybody, and it's called a four-wall syndrome. You are in a room with a four wall. This is the best part of New York. Look at the community you are here. This is the therapy for stress, is connecting with the people. Dino sheshe shakahari means you are eating little, small amount. Amader biggest thing what we have today is we are eating too much, and we eat in the wrong time. So Amader, we have a problem with our balancing the brain. We are all right-handed. I'm right foot. I never use my left hand. I never use mine. So what happens, psychiatrists should know, which they don't understand very much, but I'm going to let them understand. The two brains, called right brain and the left brain. Okay? Right brain is intuitive. Right brain is female. Right brain is your parasympathetic. Left brain is analytical. Left brain is very, আমরা বলি যে male dominant, male to the heating, sympathetic. So if I am a right-handed, if I am primarily, what I'll first do, you see, I'm comfortable standing like this. I'll put my feet together. And I keep my body at a connecting to your, let me show it to you what we do. We get up in the morning. We'll put our feet all the way to the back. Slowly my hips will touch, and then shoulder, my head, and I will go all the way high up to keep my eyes closed. It elicit a tremendous amount of your relaxation response. Now what you will do, I am right-footed, right? So that comfortably see if you can stand on your left foot. If you are sitting here, you can start, see what happens when you stand on your left foot. Opposite foot.
Actually, I'm left-handed.
To be left-handed? It's good. So go to the right foot, So to be careful, you just generally you can put it. Okay? See what happened with the left foot left. Standing on the left foot. Now if you can count 1 and 2 and 3. 10 seconds is good. 20 seconds is better.
3,
40 seconds is fantastic.
6, 7, 8, 9, 10, 11.
Okay.
You're counting too fast.
Now you will do one of the impossible tasks. Close your eyes if you can do it.
Yeah, I can do
Close your eyes, see if you can stand on one foot.
Try.
Fine. This will be a fascinating experience for you.
Yeah,
I can do it. I can do it. I can do it.
Beautiful.
1, 2, 3, 4, 5, 6.
Opposite, then you use your non-dominant hand. How to use your non-dominant hand? The first thing in the morning. First thing in the morning, when you brush your teeth with your left hand. And let me tell you what will happen. If you take your foot, brush your left hand, initially brush will be all over like this. Why? So it will be like this. By the time you can bring the brush here and start brushing, I do it every day, brush because I'm right-handed. Then your right hand will do like this. Why? Because of neuroplasticity. The brain knows you use your right hand to brush your teeth. So you'll be using left hand for all the tasks. Balancing poses, most important poses. Then will come the powerful, see I'm showing it to you these things which will incorporate into daily life. Relaxing your hand, relaxing your wrist, relaxing your body, relaxing your upper part. Now you will do what is done back home. In Bangladesh now, you'll be surprised the influence of yoga in our community. Mahajatak, anybody know Mahajatak? Yes. You took the training of 10 years back. Google him. You will be amazed who the person is. There are over 1,000 trained yoga teachers practicing in Dhaka. And I'm connected with all of them because in Bangladesh, I'm extensive follower of my yoga community. So you will start doing this very simply. Initially, you won't be able to do it. You slowly want to go down. No pain. If you get a pain, you'll back off. But stay. Slowly, you'll be able to go down. What is called a malasana. মলাসনটা কিন্তু আমাদের যে স্কোয়াটিং যেটা ঠিক মল থেকে এসছে আমাদের গ্রামের লোকরা এইভাবে বসে দাদা elimination. Why? Because your pivorectoris muscle is relaxed. Your anal sphincter is relaxed. The anorectal junction. So এখান থেকে then we'll start practicing for your daily your lifestyle is that able to get up without a support. If you're able to do it, you are already bringing your shastru. But shastru কোথাটা কোথা থেকে এসেছে জানো? Anybody knows? Probably not. স্থির মানে হচ্ছে self. Keeping your body, mind and spirit at stillness. সেটা হচ্ছে স্বাস্থ্য। জানো আমরা যে বাংলাতে সব কিছু যখন if you look at it, everything. So you will be able to sit down, try and able to get out. Okay. Sit up. Go down. Okay. Next thing.
You're doing good.
পারলে সবাই আচ্ছা আরো আস্তে আস্তে আমি যাচ্ছি I will go one step at a time
ওখানে নজরুলের পাশে চলে
আমাদের
যাও
দেশে বাচ্চাদেরকে শাস্তি দেওয়া হচ্ছে শাস্তি দেওয়া হচ্ছে না দুখান না হাত ক্রস করে if you cross your hand this is called super brain yoga and you go down and go high up then you do breathing breathe in breathe out
স্কুলের টিচার
wonderful balancing of your both side of the brain acha jara korte pereche let me go a little bit farther okay if you people can see from the back huh you go sit down all the way to the ground people who are watching
একটা স্ন্যাপ নিয়ে দিয়ে
people who are watching they can do it.
আমি নিচ্ছি পেয়ে যাবো সব
And we'll see how many people are healthy today. Huh? You're sitting down like this. From here, you will get up. Oh my God, I cannot. Easily you can get up. All the way to the ground.
There's
All
support.
the way to the ground.
No support.
All the way to the ground. Sitting down. Oh my God, what am I going to do?
Wait, 1 second.
Huh? One more second. I have to hold somebody? No, I can get up. Oh my God, I'm stuck. So easily can get up. If you use your one hand, you lose.
Come on, Nazrul bhai.
You
Do
lose
it, do it.
25% of your life.
Let's go. 1, 2, 3. That's it.
If you use two hands, you lose 50%. If you lose two hands and a feet, you lose 75%. Second thing you do, same thing you do, now you cross your feet in the opposite side. You're balancing. If you're doing it from here, ooh, so hard to get up. No? Easily you can get up. Now you go to opposite side. What's happening? Coming in. Practice. Called neuroplasticity.
Push up? You're mentioning balance,
Anything you used to get up.
no, but এখান থেকে শুরু করছে, so এখান থেকে to start from here.
তুমি কি ইউজ করছো জানো to get up? It's called your mind, not your body. If you try in the body,
আপনি যেভাবে করলেন, you did it effortlessly, like down.
Yeah, we need a cane. Actually.
আমাকে বলে কি I'm not flexible. আমি কি বলি জানো? I said your mind is not flexible. It'll come to you. If you practice it, it'll come out. Actually, all these things we talk about balancing, you lose one muscle function, another muscle function, but this is all an effortless ease. দেখো আমি কথা বলছি, okay? এবং আমি সব কিছু করে যাচ্ছি. I have no idea even I'm doing it. Why? Because I practice it. That's number one. So দেখো, I will be doing, there's a breathing, actually we'll take another, because of the time they have to do that, 10 minutes. I'm going to show you some breathing technique. First breathing হচ্ছে যে আরো অনেক রকম আসন আছে, কিন্তু আসনগুলো বেসিক্যালি হচ্ছে যে if you understand, it is a relaxation. It is in stages. আর সবচেয়ে বড় জিনিস হচ্ছে you need your spine straight and flexibility of your spine. We always say that flexibility is life. Rigidity is a
পেন
flat EKG. And final rigidity is called rigor mortis. So we don't want to go that far, okay? So we want to be flexible. Spinal flexibility is health. After your breathing, now your lungs is all better. What you need to do completely going against the grain of your habit. one very important thing, your practice has shown us, if you keep on doing exactly the same thing what you are doing, you are going to hurt yourself. You have to do opposite, going against the grain of your habit. If you put a food in your mouth, if it tastes good, spit it out, okay? If you love to walk in the beach, come on walk in the downtown New York. You have to balance yourself. Breathing, our normal breathing is, your inhalation is active, exhalation is passive. Take deep breath in. You will do first your emptying your lung. This is called your bastrika, bellows. আমরা বলি হাপড়। আপনারা কেউ দেখেছেন কি না?
হ্যাঁ হ্যাঁ কামান
আমরা তো গ্রামের ওই যে আমাদের কামার বাড়িতে হাপড়। So what it is?
yes
You generally do your hand raising high up. What you can do? Breathe out. And when you bring it down the baby fist. Balo Mushti Mudra. এটা you will do until you have an effort in breathing. That means if you cannot talk anymore, if you cannot sing anymore, you will stop. How long? Depends. I can do for a long time. Why? Because I do every single day. এটাকে আমরা করি, this is the beginning of this. It is called your bastrika pranayama. The bastrika pranayama যেমন করি, bastrikate হচ্ছে যে again it causes aerobic glycolysis because it brings more oxygen in. So if I have a pain, suppose I have a pain in the neck, what I will do, I will put in a posture where I have a sort of pain, and from there I can do it with just moving my shoulder like this. You will be surprised within a short time, your pain will be disappearing because it is happening. It's happening for all of us. If you have a knee pain, what I will do, I'll sit down here, I will slowly take my knee, I'll keep it here, slowly I can put it down here, and eventually I'll go what is called a Gorurasana. This is called your, I can wrap around eagle pose. আমি এভাবে বসে আমি যখন খাবার খাই আমি খাচ্ছি পড়ালেখা করছি my feet is like that. Now let me tell you what happens. All of us have a knee problem and half of our people have a knee joint replacement. Your cartilage, loss of cartilage, everything have no pain fiber. Cartilage has no pain fiber, even bone marrow has some pain. All the pain fibers are in the ligaments and the muscles. Why? I have a problem in my left knee. I have a meniscus tear, I have a, arthritis. My body is trying to splint it. Body is trying to tighten up the ligament, tighten up the muscles. That is causing pain. Underlying condition is not going to kill me. It is going to make my life miserable. So if I keep like this, look at that, I'm very comfortable sitting like this. Then I'll go again. What I will do, same food I will be doing. And here, putting this position, I'll be doing my Bastrika Pranayama. All my orthopedic surgeons are out of business, huh? No more knee joint replacement. I have so many people come to, I have a huge number of people come to my class and guaranteed, more than half of the physicians. Physician comes from two reasons. First one, I'm tired of taking this dirt medication. I'm 10 pills. I'm having all the side effects. How can I get rid of it? A proper activation of parasympathetic tone will do to you. Reduction of the pharmaceutical support. better management of the chronic lifestyle related disorders, and better quality of life. Pharmacomafias are controlling us.
Yes.
$350 billion business. আমার বন্ধু বান্ধব আছে যারা 9:30টার সময় 4টা পিল খেতে হবে, যদি না খায়, যদি 9:31 হয়ে যায়, দে ডেড, মানে মরে গেছে। ইন্ডিয়াতে আমি গেছি, বাংলাদেশ তো আছে, বাংলাদেশেরও জানো কি ড্রাগ কোম্পানির কি অবস্থা, মেক্সিমকো যা, এনিওয়ে they're all everybody is drug addict in Bangladesh, মানে প্রেসক্রিপশন ড্রাগ। প্রেসক্রিপশন ড্রাগ কি বলে জানো? বলে লিগ্যাল ড্রাগ ডিলার। Amra, after coronary intervention, we get aspirin, statin, beta blocker, and ACE inhibitor, standard for all cardiologists. When I was big guest speaker in India, I've been to guest speaker in India many times, they have a one called a polypill. Polypill has all 4 of them in it. Aspirin, statin, beta blocker, ACE inhibitor.
Yes, combined.
All combined is one pill called polypill. And it just blew up my mind, I said, wow. Kapalbhati pranayama. You have a balloon here, you have a diaphragm here, you have another balloon here. So what do? You sit down, bring your concentration belly button, push your belly button to the back, it will hit your diaphragm, hit the balloon, air will come out. So you can put your hand in a belly button, push it in, air will come out. Acha, বলছে আমার হচ্ছে না, I cannot do it. I say very simple. Can you cough? Huh?
Always.
Cough. Now cough with your mouth closed. কপাল ভাতি মানে হচ্ছে কপাল বাতি, মানে you look like you are glowing. People who are healthy, it looks like, oh, Bobiri, you look at you. You look so healthy, you look like glowing. আমরা এটাকে বলি তেজ, তেজাজ। আমরাকে বলি আমরা অগ্নি, জ্যাঠার অগ্নি। We have a fire in our within a body. So what we do here, we push it in, and if you look at me, there is no inhalation. So when a baby is born, baby took a deep breath in. Baby never took a breathe. Learn how to breathe out. Okay? So look at me now. Here I am. I'm going to do it just to show you, and I do it for a long, long time every day, and what the effect will be on me. I did not take any breath in, but I breathed in without knowing. Subconsciously I took a deep breath in. So you continue this. This is the second pranayama. This is called your metabolic pranayama. What it does, it massages all the internal organs. So if I'm doing like this, if you see that, I massage my liver, massage my stomach, massage your spleen. So it's all massaging your internal organs. Most important of breathing is activating both sides of your brain. It is called alternate nostril breathing. Left nostril is controlled by the right brain, right nostril is controlled by the left brain. So what do? You tell me when to stop, because I don't
I'm gonna go to lecture.
Go to lecture? Okay. Okay. So five more minutes, then we'll start the lecture. No interruption, we'll go lecture from here.
No, money was to share, right?
No, but
Morning?
Islam shouldn't.
Okay.
Delay the lecture till about 8 and with the break now, because we have namaz, you can do namaz at
Okay,
4.
go to namaz.
8 o'clock lecture ban, so people can do this, so we don't want to interrupt the
নামাজ
lecture.
কখন বলো? নামাজের সময় কখন?
About 7:40.
7:45, 40:50.
So it's only 7:50 now.
So let's go till 7:30, then you take a break and stuff, and then 8 o'clock we
We start that.
না, আমরা কি কি আছে?
PowerPoint presentation আবার
What are the other things you're going to show? Lecture?
মানে এটা হলো অনেকটা প্র্যাকটিক্যালের মতো, ওটা হলো থিওরিটিক্যাল।
Half an hour lecture.
I can do it half an hour.
No, but Dilip, this is good. You can continue. Yeah. हमारे गान बाजना है. We hear that every day.
Okay. So use if you use your right hand and close your right nostril, not much, just underneath your nostril. Breathe out first through your left nostril.
Breathe out or breathe in?
Breathe out. Now breathe in through your left nostril. Drop your hand down, close your left nostril with your little finger and ring finger. And breathe out through your right nostril. Breathe in through your right nostril. Drop your thumb down, close your right nostril, breathe out through your left nostril. Breathe in through your left nostril. Close your left nostril, breathe out through your right nostril. Then what you do, you can put your index finger and middle finger in between your eyebrows, close your eyes, bring your attention to your in between your eyebrows, and you continue your alternate nostril breathing. Within a short time, you'll see you will have no connection with your outside world. You will never know where you are. You are in a tremendous amount of calmness and peace in your mind.
Oh, I thought it gave dementia.
What it does, basically it activates both sides of your brain and quieting down what is a sound, a vibration. Our brain is in a state of vibration and our body is in a state of vibration. We create a vibration and that is called, next one called a Bhramri Pranayam. Bhramri is a Bhromorid Jamadir sound of a bee, it's called a bumblebee breathing. What you do first, you learn how to shut down your five senses, because activation of your five senses is a root cause for your activation of sympathetic tone. Why? I'm I have to turn my head. If I'm listening something, so the way to shut down your five senses is you put your, I'm going to demonstrate, then we'll do it together. You put your index finger in your, between your eyes. Use your three fingers to close your eyes. Use your thumb to close your ear and then close your mouth. Literally, I'm shutting down my eyes, my hearing, my taste, and my smell. I'm going to breathe out first. I'm going to take a deep breath in, then I'm going to breathe out with the sound of a bumblebee. Let me show it to you, then we can do it together. Breathe out first. Take a deep breath in. One more time, breathe in. Within a short time, you'll have no idea where you are, where you're connected. Next, you do pumping and cupping. You take your both the hands, keep rubbing. When you keep rubbing your hands will generate a heat in your hand. When you take the heat, you take your hand, if you're wearing glasses, you remove your glasses, as a cup, put it over your eyes. Let me tell you what it's doing to your eyes. Your eyes have a ciliary muscles. Ciliary muscles get relaxed. Your lens is a convex lens, and ciliary muscle tightens it up. It reduces your convexity. So it increases your convexity. So what happens, it acts like almost like a reading glass. Take your hand, massage your forehead, massage your eyes, massage your face. All the muscles of the face are attached to the skin. So what happens when these muscles are relaxed, your frowning goes away. All of your line goes away. That's what called tejas. Then you take your hand, massage behind your earlobe, massage behind your ear. It's called an auricular branch of vagus nerve. You are activating your vagus nerve, parasympathetic tone. Take your hand, massage both sides of your neck. These are called carotid sinus. When you massage your carotid sinus, you relax your cardiovascular system and nervous system. What do you do? Supraventricular tachycardia, we do carotid sinus massage. Exactly what we're doing. Take your hands to the back, massage your two muscles, trapezius and sternomastoid. Both are supplied by your cranial nerves. And again, I'm going to show it to you. My mouth is still extremely wet because I'm getting a saliva from my stimulation of my, the parotid gland and so this is a sign of your parasympathetic activation. Then you practice two other pranayama, very important. Pranayama. Pran ki jinish amra keu jani na, we nobody knows. কিন্তু আমাদের সারা বাংলা ভাষায় প্রাণটা চলে গেছে, প্রাণটা কোথায় গেল? আরে আমার প্রাণটাকে নিয়ে আয়। আর প্রাণ চানাচুর, আর প্রাণ আজকে যে কোথায় উঠে গেছেন উনি, ওনাকে আমরা দেখেছি শুধু চানাচুর বানাতে। আজকে প্রাণ তো বোধহয় 120টা দেশে ব্যবসা করে উনি, চালে যাওয়া বাকি আছে প্রাণের। Pran is like a subtle energy. Breath is the carrier of that energy. Breath is not the pran. Metaphorically, pran is like electricity. Breath is like your electric cable. It carries your pran to your body. We as a Western, we really don't know what it is. So, you do one thing, you will be able to improve your whole breathing capability when you practice against resistance. What is called a breathing technique with a resistive inhalation, resistive exhalation. And I'll show you those two. You'll see it's very simple. Slowly constrict your larynx and try to breathe in like this. If you develop cough, that means you have tried to affect the right place, because cough comes from your vocal cord of the larynx. Okay? We have ENT guys, and I always show them the ENT guys how to do it. So we're doing. Then you can take a deep breath in, then breathe out completely. Then you do. It's a wonderful technique if you can do it, because it will build up your lung strength. Finally, what is called your shankho pranayama. Shankho হচ্ছে আমাদের যে দেশে আমরা শঙ্খ ফু দেই, শঙ্খ ফু দেওয়াটা হচ্ছে is a tremendous power of your lung capacity. আমরা করি, আমাদের শঙ্খ নেই, দুটো হাত, we do the balo mushti mudra, and we put one mudra on the top. So what we'll do in doing, okay, before that, you never do any breathing through your mouth. God gave the nose to do the breathing. Why? The moment you start taking the air through your nostril, first the air gets purified. Nose is a filter. Then our nose is a personal air conditioner. Outside air is warm, it will cool it down. Outside air is cool, it will warm it up. Then the air goes through the side of the nostril, is called a turbinate. is like a two channel. Goes to the turbinate, it generates called a vortex. It creates a vortex, goes over the mucosa of the sinuses, and mucosa of the sinuses secretes nitric oxide. If you want to know all this stuff, go to PubMed and I'll show you the 7,000 articles. If you put down nitric oxide effect in the body. Nitric oxide is a powerful vasodilator. It is an activator of parasympathetic tone. Two other substances, cyclic GMP and acetylcholine. It is the opposite of your epinephrine, norepinephrine. So endothelial health today is our health. And if you can think about very simple way, since you have until 45, because we will do the presentation after namaz, it's okay? What we'll be doing is that a coronary or any artery in the state of a sympathetic overdrive, it is a tight. When it's tight, endothelium is not healthy. So when endothelium is not healthy, that unhealthy endothelium, what will do? It will attract. I'm not going to for a medical on all the things. I'm to the simplest concept. It will attract all the cholesterol, all the fatty things, and it will form your plaque. Plaque doesn't cause any coronary artery disease. It's called plaque rupture. Plaque rupture, because of 30% blockage, plaque rupture will cause 100%. Plaque rupture happens because of your change in your hemodynamics. That's why beta blockers, we always give a beta blocker to the cardiac patient because beta blocker is a cardiac protector. So, since we don't do mouth, I'll breathe out first. I'll breathe in through my nose. I'll breathe out through my mouth against resistance, as if I'm blowing a caution. Lot of other practices are there. So generally we sit down, close our eyes, we do all the asana practice. And asana practice, there is no end of asanas, but all the asanas are in sequence we do in stages. What you call in stages, impossible become possible. We do the vibration, very important vibration because it quiets down your mind. And you remember one thing, we have all the EEGs, EKGs, whatever you do, it is all the vibration. And this thing quiets down your vibration, and you always practice at the end a calming, cooling, and most important practice is the pumping and cupping. Kind of pumping and cupping you do very slowly. And I tell you one thing, my wife is here, she knows very well, at my age and my whole family, I've never touched reading glasses. And she said, don't do it too much. I said, yeah, look at me. I'm going to live, I don't know how many years, but I'm still very, if you can relax your ciliary muscles, money back guarantee, your vision will be better. Because your lens will be more convex. So finish with that. And I'll be open for question and answer. And I love two groups of people. I love psychiatrists and I love cardiologists because they are so tough to go to the head, They're very tough.
So my first question.
First question from a psychiatrist.
Because back home I was a cardiologist.
Oh, God bless you.
Combination.
What a combination.
So one question.
Yes.
Yeah, for the general people, general patients. So you have this all yoga techniques and all this thing. Is there any time limit? For example, you have shown a lot of techniques about the knee pains and all this thing, and just now is there any time limit that after that? For example, you told that you have never used any glasses, right? So now I'm using glasses. So is there any way I can use all these techniques? Can I go back? No, this is
And then reverse it, then it.
yeah. For example, you showed about arthritis, and this is on behalf of Dr. Masoom Kadir, who is getting all these pain management, and getting incomes and all pain. So is there any criteria or cutoff point that okay, after this my yoga technique is not going to help?
Okay. First of all, it's an individual practice. It is a non-competitive practice. That's what we tell everybody you do with your eyes closed. What you are experiencing within you is a parasympathetic activation. The moment is a physician, the best thing about a physician is, see what will happen to me. Let me tell you, how long you can do it, okay? You do it every asana, every pose as if it is your normal breathing and it is your normal body. Okay? So here, this is called your triangle pose, Trikonasana. I'm putting my hands here. I put my touch here. I'm doing here. It's bothering my back off. But I stay here. But stay here, it will happen here. Slowly it will happen here. So answering to Munib is that there is no time limit, no restriction. You start where you are. You start with no pain. We tell you a little bit, you have a little bit of call a comfortable discomfort. I won't tell you that you are not going to be, you are going to have a little discomfort, but no pain and effortless breathing. And once you go there, slowly and slowly what will happen, all of the studies have shown, this increases your serotonin, it increases your called dopamine, oxytocin, serotonin, and endorphin. 4 neurotransmitters make our life beautiful, make our life miserable, and keeps all the psychiatrists in business. Follow, sir.
So, sorry.
Sure.
So, multiple questions, but
Sure.
number one is, with our lifestyle, with our daily schedule and all that, where do we start? How much do we have to do in each session? If we do 2-3 things at a time, does it have additive effect? Because the breathing thing, we can do in between patients, right? So to take time away for a specified period of day, we need to sort of understand how slowly we can start and how do we incorporate that in our daily work schedule.
First of all, you start. Doesn't matter where, how long. You don't find time for yoga. Slowly when you do it, when you establish, get the sensation that yoga will find a time for you. My physician friend comes, I have 5 minutes in the morning. I said, fine. Go against the wall, keep your spine straight, close your eyes, do the breathing out longer than breathing in, just do it for 2 minutes. He said, oh, I was doing 4 minutes. Next thing he said, no, I didn't know, it was already 10 minutes. So what will happen to you, we prefer you to do it in the morning, empty stomach before going to work. We as a surgeons, we go to work at 5:30 in the morning, 6 in the morning, or whatever time, but we do something. First, like when I started doing it sitting down in a malasana and I'm drinking water. When I drink water, I get a bowel movement, I get up, and I do a little bit of your spinal relaxation, I go to work. That's enough for me. In the work, it is incorporating now. In the work, I'm doing this. So, when hand is relaxed, what will happen? Your fingers will go like this. Your hands will be like this. If fingers are tight, it doesn't go. So, answering to you, Really? Say, you start.
Indeed.
And once you get the effect of it, then he said, no way you can come back, It is a wonderful experience in your life. It is called art of transformation. Rogi theke nirogi, nirogi theke jogi.
আমার একটা প্রশ্ন আছে
Bolo.
as a cardiac surgeon
Yes.
we operate a lot of cases
Sure.
is there any study until now যে যাকে এনজিওপ্লাস্টি অথবা সার্জারি প্রপোজ করা হয়েছে অথবা যার বাল্ব ক্যালসিফাইড বাল্ব অ্যাওর্টিক বাল্ব মেইনলি আফটার ডুইং দিস যোগা is there any study or any publication they have reversed the disease process?
I'll show it to you.
Thank you.
Dilip da, I have a comment actually.
প্রশ্ন না টাইম তখন লিডারশিপে যারা নামাজ পড়তে যান উপরে
just last question.
But we'll continue the QA session. So about 8 o'clock, everybody has to be back here. We're going to start the second session. The time is running out.
Before I leave, I just have a comment. Dilip da is a master of yoga, and I'm just a baby yoga. I did some.
Already it didn't even
So
start.
you have a future.
So one thing,
have a future.
it may address Munib's question also. One thing is in yoga they say you go with your body, not against your body. And whatever Dilip da
That's
showed,
tolerated.
we cannot do anything like that tomorrow. It comes to you. It comes to you. You don't go to yoga or try to bring it to you. I compare it with love. Let the love come to you. You don't run after
I
the love.
thought he had a business proposition.
What a connection.
I have one comment.
Yes, go
Yeah.
I know you're a religious guy, you know, I know you pray. Why don't you, after your prayer, just do it for 2 minutes, incorporate there? I have, I'm actually, somewhere, you know, when I'm not around, you know, Dr. Sarkar, he's also Dr. Sarkar, Shumi Sarkar, he covers me. I mean, in between busy practice, he will just cut off at 1 o'clock, he'll get up, he'll go to upstairs to his private room, and he will do meditation for 15 minutes. It's like if you see him, like you'll see like a rock sitting there, no movement, nothing. 15 minutes, he gets up like suddenly, and he said, I'm completely rejuvenated. You know, I have been asking him for years, like, you know, teach me what you're doing at least. He always says that it is something you can learn. So, you know,
Yeah, Munib can say it. He gets into a catatonic stage.
No. Let me tell you one thing. I had a presentation one time, Islam and yoga. So if you look at the whole Islam, starting from the morning, even তুমি যখন ওযু করছো,
I was just telling him about it.
everything. নামাজ পড়ছো তুমি, the 5 asanas in namaz. দেখো নামাজে তোমরা বসে আছো, you do the vajrasana. And যখন নামাজ পড়ো, you do it so well because you've been doing it every day.
Namaz is complete yoga.
নামাজ
I was just
That's
telling
the
him.
best yoga.
That's what I'm saying. কিন্তু তোমাদের প্রবলেম উইথ দ্য নামাজ হচ্ছে যে again I'm not mentioning anything. তোমরা ভাবো যে নামাজটা আমার একটা ডিউটি, নামাজও করতে হবে ডিউটি। নামাজ is to let go. নামাজ is your part of your 5 ওয়াক্ত নামাজ পড়বে যে তুমি জানো না যে তুমি নামাজ পড়েছো। 5 ওয়াক্ত নামাজ পড়বে as if you're brushing your teeth. You didn't even don't know you have to go to the নামাজ। আমাদের হচ্ছে না আমি মুসলমান, আমার দেখাতে হবে যে 5 ওয়াক্ত নামাজ পড়তেছি, বুঝলা? If you do that, then you will see এই যে তুমি যখন নেমে আসছো, পদহস্তাসন করছো, বা তুমি যখন নামাজে যখন বসছো, তুমি এভাবে you feel that effect of the relaxation response. Okay, time for namaz now.
All right.
Okay, so much.
Thank you.
Yes.
Okay, yeah.